Hi, Dr. Ray McClanahan here from Northwest Foot and Ankle. We recently received this following question that we'd like to answer today. When does someone really need traditional orthotics? And the other part of the question is, who benefits using traditional orthotics in conjunction with correct toes? If you happen to be a person who's going to wear a shoe that's got your heel up, that's got your toes up in the air and your toes pinched in, your foot is going to collapse more, pronate more than it should, and maybe you might get some symptom reduction from using an orthotic. However, there's a better way and a more natural way, which is to reposition your great toe the way nature intended. And once you do that, when you get your big toe in line with your metatarsal, most everybody that I evaluate have a normal medial longitudinal arch. It's only when the big toe gets pushed over that the arch will tend to collapse. So conventional therapy for pronating foot or a collapsing arch is to lift up under the medial longitudinal arch. Natural preventive therapy for a hyperpronating or a collapsing arch would be to open up the toes. So in other words, if you wear a shoe like most of the shoes out there and your toes are pinched in and your heel is up and your toes are up, your arch is going to pronate more than it would ordinarily, because that's not the position that our foot is built to bear our weight in. If you can find yourself in shoes where your heel, one end of your arch, is flat and level with the other end of your arch, which is your forefoot, most people will not pronate too much from this configuration. Most people will pronate just the right amount to absorb their body weight and the shock, and supinate just the right amount. It's only when we let the toe go over, which is where most shoes, even athletic shoes, hold the toe, that we then end up seeing too much of that pronation. And the reason why people get concerned about pronation not only is the flattening of the arch and the malposition of the big toe, but when the arch pronates, the lower leg bone also internally rotates, and so that drags your whole leg out of alignment. So yeah, one way is, if you're going to wear a traditional shoe that deforms your foot, is to put an orthotic in there and lift it. A better way, however, is what we're talking about here, which is get your foot positioned the way nature intended. Your knee will be right on top of your foot arch will maintain itself just right, but notice the position that the forefoot is in. This is natural position. There are certain foot types that require orthotic therapy, and one of those foot types, in my opinion, is a foot that's called a forefoot valgus. And what that means is that when the heel is looked at in relationship to the front of the foot tilts downward like this. And so when this person walks and runs, everything's fine when they contact the heel, but as soon as they come forward on their foot, their whole foot and ankle undergoes a supination, and that oftentimes is responsible for tearing their peroneal tendons. So if a person has that condition, a forefoot valgus, and it's rigid, meaning that it doesn't come down to ground when they're weight bearing, then that person might very well benefit by having an orthotic made that lifts this part up to keep it level with where the big toe wants to go. There's also a condition called forefoot varus, where the front of the foot is like this. Again, if it's collapsible, it might not be a big deal. If it's a forefoot varus where it's rigid, that person will have lots of musculoskeletal problems, because when they go forward onto their foot, their whole foot then will collapse in. So those might be two indications where a person might actually benefit from an orthotic, but in my practice experience of 19 years, those people are fairly rare in terms of that kind of a foot type.
Now, the toe spacer that you just put back on that foot is also an orthotic, but distinctly different than the kind of orthotic we were just describing for the people with midfoot conditions.
Yes.
Can you tell me the difference?
Yes, that's a good point you bring up, Aaron. This orthotic, Correct Toes Orthotic, is designed to do the same thing as a traditional orthotic in terms of lifting the arch, but it does it in a natural fashion. In other words, it does it by harnessing the ability of the big toe to do what it's supposed to do through the flexor hallucis longus tendon, which starts out as a muscle on the back of the leg. So yes, this type of orthotic is also effective at lifting the medial longitudinal arch, but not in an artificial, unnatural way by lifting up under here. It does it in a natural, healthy way by getting your big toe out where nature intended for it to be to begin with. So we prefer Correct Toes Orthotics, which is a natural type of orthotic, as opposed to putting something artificial under the medial longitudinal arch.
So the Correct Toes create arch support by stabilizing the end of the arch, helping you lift the weight over open space, in opposition to the traditional orthotic that lifts the middle of the space.
Exactly, yeah. So a traditional orthotic, in my estimation, really is not an arch support, it's an open space support. And our foot was never intended for anything to be lifting up under there. And what you'll discover in your own body is if the forefoot part of the arch, as Aaron is talking about, is level with the rear foot, your heel bone, for most people the medial longitudinal arch will do just fine. It's the rare person that I see when their big toe is in natural position can still completely flatten out their arch. And that person might benefit from a traditional orthotic. But for the most of us and the majority of the patient population, we'd rather get the big toe into that natural alignment and support your foot naturally.